Good afternoon. How are you tonight? This afternoon, tonight already. My name is Fawn Lopez. I'm publisher of Modern Healthcare, and it is my great pleasure to welcome you to Modern Healthcare's Opioid Crisis Symposium. On behalf of our staff, I'd like to thank you for joining us today at this very important conference and pre-conference sessions. We have all heard the staggering statistics. Currently, every day, more than 90 Americans die after overdosing on opioids. Nearly 64,000 people died in 2016 due to opioids, with nearly two-thirds involving prescription opioids, heroin, fentanyl, or some combination of those drugs. Opioid-related overdose deaths rose by 27% between 2015 and 2016. And drug overdose account for the highest number of deaths for Americans under the age of 50. When the final number for 2017 comes in, that figure will be even higher. This afternoon, we will be showcasing how the city of Baltimore has been a pioneer in identifying opioid addiction as a top threat and more importantly, is taking action. The city of Baltimore continues to see more people dying from overdose than from homicide. Baltimore addressed opioid addiction through a series of comprehensive solutions that have made a significant impact to stem the high rate of deaths due to opioid addiction. Before we start the program, I would like to thank our sponsors for their support of this important conference. Our premier sponsor is Dr. First. Supporting sponsors are Allscripts, Axial Healthcare, Basira Pharmaceuticals, and our charging station sponsor, LabCorp. Finally, our welcoming reception sponsor, On Cue Pain Relief. Thank you to our sponsors for their support. Now, I'd like to go over a few housekeeping items. You should have picked up your badge and at the registration table in front. So please wear that badge all day, throughout the day. And please kindly silence your phones. And after each session, our presenters will take questions. So we have Modern Healthcare staff in the room to handle your questions. And if you need anything during the conference, please don't hesitate to ask myself or one of our staff members. We have members in the room, people from Modern Healthcare throughout the room here. So please don't hesitate to ask us. Now, without further ado, I would like to start this afternoon's program by introducing Catherine Pugh, Mayor of the City of Baltimore, who will be providing the opening keynote remarks. Mayor Pugh has been a public servant for more than 15 years. She was elected to the Baltimore City Council in 1999 to represent the 4th District. Her abilities to negotiate and her bipartisan approach catapulted her into various leadership positions in the Maryland Senate, including serving as the majority leader. She is the founder of the Baltimore Marathon, which is in its 17th year and has over $30 million impact on the city. Under Mayor Pugh leadership, Baltimore is expanding addiction treatment by opening a stabilization center and engaging with hospitals. She has played a critical role in launching multiple initiatives with community groups and public safety partners like Law Enforcement Assisted Diversion, LEAD, and the Don't Die campaign to fight stigma with science. Now, please join me in welcoming Mayor Pugh.
Good afternoon. Let me first welcome all of you to Baltimore. Thank you for being here. And as serious as this conference is, I do hope you get a chance to walk around our city and spend some money. So, Fawn, let me say thank you, and as the publisher of Modern Health, thank you for all that you bring to this. You have one of the greatest health commissioners in the country here in the room that you all will hear from very shortly, Dr. Nguyen. But let me just remind you all, and I'm sure that among the reasons that you are here is to discuss this national crisis that is gripping many cities around our country, our state, and the world. This opioid crisis is not just indicative to Baltimore or to your particular city or to your particular state. This is an international issue, and it's something that we all must come to grips with. Nationally, 64,000 people died last year from an overdose. More than 42,000 deaths involve prescription drugs. Baltimore has seen some 694 overdose deaths in 2016, and that number surely to increase in 2017. Let me just say, while we believe that we are getting in front of this issue, I can tell you that this is going to take more than just conversations, more than just the gatherings of individuals. It is really going to take a lot more research and interaction and conversations around what are we doing to really solve this problem. And the reason I bring that up is because substance abuse alone costs this country some $600 billion. $600 billion. And that is the cost to our nation. And when you think about it, we often have found in the past that people who suffer from drug addiction may also end up with mental illness, may also end up incarcerated. And here's what we do know, that incarceration is absolutely not the answer. Even when you think about methadone treatment at $4,700 per person, when the average cost of incarceration is about $24,000. And the conversation that I hope that we will have in the future around drug addiction and drug treatment is how are we using technology to deal with this problem that is gripping our state, our country, and the world. And one of the things that I was a big proponent of when I was a state senator was looking at how are we using telemedicine to address the addiction issues that are facing our nation. While we have come up with one of what we consider the unique ways to deal with drug addiction and opioid addiction in our city, developing a stabilization center, and which will provide wraparound services and put people into the services that they need, we think that that is important. But let me just say this to you all. Beyond stabilization centers is the responsibility of hospitals to look at drug addiction as an illness. And that is a conversation that we're having with our hospital systems, because we want to act like it's just a criminal activity or a crime to become drug addicted, but yet we look at it as an illness. And so every hospital system in this nation has to take some responsibility for drug treatment, because we cannot just put this out in neighborhoods and communities and think that they can solve it alone. And whether we know it or not, I always tell folks the question we must ask ourselves when we begin to think about drug treatment and how drug treatment impacts neighborhoods and communities, ask yourself one question. If you're a drug dealer, where are you going to go stand? Near a drug treatment center where you have a ready-made clientele. So we must be very strategic in our conversations and our thought processes in terms of how we're treating individuals. And while we must treat them where they are in terms of their immediate problems, we must be able to take them to places where they can be stabilized. And hospitals have a responsibility to be in this conversation and to assume their roles. So I know that these conversations will be robust throughout this meeting, and I hope that you all will look at new ways and new solutions and will involve yourselves in the concept and the attitudes about the future. What do we want our cities to look like? What do we want our states to look like? What do we want our country to look like? And ultimately, what do we want the people who are addicted, what do we want their outcomes to be? Thank you for the opportunity to welcome you to Baltimore. And again, I hope you have robust and great discussions. Thank you.